Excellent. Welcome all. Thank you so much for being here. Sorry, it says half slides. Okay. Sorry, I'm new to this modality here. So bear with me. Okay, full slides now. Great. Thank you so much for your feedback. It's so helpful. So the chat box is there for any questions that come up. My hope is that I will just sort of run through this slide set, this intro to Ayurvedic medicine slide set. And then if you've got questions as they come up, please send them via the chat box. And then we'll definitely have some time for Q&A afterwards. I'm also trying to figure out how to admit more people in as they join. So this is my next struggle. Let's see. Okay. Excellent. I think I'm getting the hang of this. Alrighty, so welcome to the DocTalk. Sorry, we're running already behind, but this is a special DocTalk this week that is specific to Ayurvedic medicine, which is my subspecialty here at Prosper. And every month at the Prosper Docs get together and we put together a DocTalk on all sorts of different things that we see clinically in practice, etc. This one's a bonus free one. So if you are interested, next week's sort of official DocTalk is on the microbiome. So here, this one's all about Ayurvedic medicine. And now I have to switch the slides. Let's see. Okay, excellent. Here we are. This is the clinician team. Dr. Molly Force is the clinical director. Myself, Dr. Rosalie De Lombaert, and my colleague, Dr. Mary Schroeder. We do team care here. That's just the basics. So ultimately, here in terms of Ayurvedic medicine, my goal is today is to introduce you to this phenomenal healing modality that dates back to prior to, before Christ era, ultimately, a medicinal technique from India that I hope to just impart some wisdom onto you so you can add it onto your regimen, your healing regimen already. So in general, our outline here is what is Ayurveda, what are the Ayurvedic doshas, how to assess your Agni, your Ojas, and your Ama, and then end with some basic Ayurvedic treatments. We will dive into all of these concepts so you will be skilled in knowing how to navigate them and what they are by the end of this talk. There's a couple intermissions in there, which I add in because they're moments where I sort of break from the doc talk and talk a little bit more personally, and I'll probably ask you some audience questions. I would highly recommend getting a piece of paper and a pen because I'll have you sort of jot down some things on the side as we go through here. So if there's no questions, we sort of will proceed. So Ayurvedic medicine is in Sanskrit known as Ayurveda. As you can see here, Ayu means life and Veda means science. So ultimately, this is the science of life. And more beautifully, it's the medical practice for how to live a prosperous life ultimately. So traditional medicine of India, and in 1500 BC is when the Vedas were written, these medicinal texts in Sanskrit that sort of finally put together these concepts in a way that could be passed down through the written tradition. It utilizes a 5-element theory, which maybe you've heard of in traditional Chinese medicine, but this is sort of similar. The elements are a little bit different. These 5 elements come back time and time again and help inform both health and disease. It also informs everything beyond just the human self, right? It informs what's going on the outside, ultimately, from the seasons to diet, okay? So we'll dive into all of that. Ayurvedic medicine, like I said, it's 5-element theory. In this case, it differs from Chinese medicine because there's elements that are different, okay? We start with air, which is just this very windy, cold type of element. And then we've got space, which basically is the lack of anything, right? It's a space we can fill ultimately, which is an important concept that we will dive into later. Fire is next, okay? And if you can imagine, we talk about fire from digestive fire to, a fiery attitude, right? Water is the 4th, and this is sort of our cold and liquid component. And then earth is last, our most grounded, I'll use that word, element here. All of these 5 elements combine together to make what are known as the 3 doshas. And I'll use this term over and over again. And doshas just means a mind-body type, okay? So instead of just thinking about health as a physical body, the doshas offer a way to think about health from the mind-body perspective combined all together. The goal of Ayurveda is balance, okay? So I'll remind you of this again and again. The goal is to balance all of the elements. The goal is to balance all 3 doshas, okay? Any questions so far? Excellent, we'll move right along then. So diving into these doshas, like I said, it's mind-body type, but another way to think of it is as a constitution. And I remember in naturopathic medical school, going to one of my first classes that was called constitutional assessment. And I remember thinking, what does this mean, right? I sort of thought of the Constitution of the United States originally, but ultimately this is a phenomenal concept that is a way of talking about, like I said, mind, body, spirit, all in one, what makes you up as an individual. Ayurvedic medicine is an individual type medicine, so it takes into consideration your unique constitution. Doshas are functional principles that govern everyone and everything. There's these 3 types: Vata, Pitta, and Kapha. Okay, so now we sort of get into the nitty-gritty. As you can see up top here in this image, that is Pitta dosha, okay? Pitta is our fiery element. On the right is Vata dosha, and it combines together air and space. So this dosha has those characteristics. And then lastly on the left is Kapha dosha, which combines earth and water. And you can imagine this dosha is the heaviest of them all. Most people have 2 doshas that make up their individual self. So this is known as being dual doshic. Again, here the goal is balance. So most people having 2 doshas need to pull from that 3rd dosha to find balance, okay? So let's dive into what Vata dosha is, okay? Remember, it's the air and the space elements. Vata type people here are divided out into body, mind, and common pathologies, okay? So our Vata people are very airy, right? So imagine lanky features, thin body habitus, maybe dry skin and hair. They're quickly moving around, right? There's a lot of space for them to inhabit and zip around in ultimately. In terms of their mind, Vata people are very imaginative, right? They're creative, they're entertaining, they have this space to occupy, and they really dive into it, okay? They can also be quite anxious and forgetful, right? Spacey is one of the characteristics of our Vata people, and they can be quite disorganized as well. Commonly, when you have a Vata ailment, we think of things that are not grounded, things that are dry, things that are cold, okay? Scoliosis is a big one. Musculoskeletal complaints, Vata people have very, very often, as well as just pain, musculoskeletal pain in their joints, in their muscles. Pain is a big Vata ailment, okay? Constipation, of course. You can think of someone who is airy and spacey. It is hard for them to have lubricated bowels and to have healthy, normal bowel movements. So constipation is a very big one that we're dealing with Vata people. Naturally, bloating, flatulence, burping, think of all of the air in the GI tract, right? Very, very Vata. And then lastly, a big one here are nervous system issues, from mood issues to neurologic issues. Vata people really have a hard time finding balance and feeling grounded. And hence, this also ends up being a big picture of the common ailments of our Vata people. Next dosha is Pitta, okay? And like I said, Pitta is fiery. So in terms of their body types, Pitta people quickly build muscle. They've got angular, sharp features. They've got piercing eyes, okay? They're also witty and sharp and intelligent and very type A, okay? Imagine, you know, our relentless, like a big boss in a company, right? Just having their own opinions about things, very organized, things need to sort of happen in their way. That is a very Pitta person. It also means they can be really irritable and angry, impatient, and just relentless. So it's a matter of finding balance within this dosha as well. Common ailments, as you can imagine, are very fiery ailments, okay? From hot, so they'll be hot and more liquid in terms of oily, okay? So diarrhea is a common experience here. Heartburn, right? Acid reflux. Acne, which is purely most commonly just quite inflammatory, right? It's full of Pitta, full of fire. Eczema is another big one. Balding and hair loss, because that fire rises and affects the head and the hair on the head. And then lastly, in terms of mood, there's often difficulty regulating irritability and anger with these Pitta type people. Kapha is our last one, our last of the three doshas. And remember, everyone typically has two doshas. So I want you to think about this and maybe write this down on your piece of paper as we sort of talk about this last dosha. Where do you feel like you fit among these doshas? Kapha is earth and water elements. So in terms of their body habitus, Kapha people are sturdy. They have voluminous hair, very lustrous features, clear skin, and they can also be quite slow moving. Very different as compared to our Vata people, who kind of buzz around and can't get them to stop and sit down. in terms of the mind, the Kapha person is, like I said, very grounded. So they are loyal, they're caring. They're usually, if they're balanced, quite content and joyful. They're sort of happy to sit on the couch and watch the world go by, right? When a Kapha person is out of balance, they can have a dull mind. So difficulty motivating, hard time getting out of depressive states. Common ailments, as you can imagine, with these earth and water elements, we think about weight gain. Kapha people have a very difficult time losing weight. We also think about swelling or edema in the ankles, right? Think about that liquid component, the water component. They tend towards cough, phlegm, mucus buildup, be it postnasal drip to just a chronic wet cough. And then, like I said earlier, they tend towards depression as well, right? Our most grounded type emotion where we can't get up off the ground. So here's a moment where I want you to think about, what are your doshas? Are you dual doshic? Is there a strong primary for you with a weaker secondary and a tertiary? This is where you get to sort of think about what your constitution is, what you are made up of. So I've got some examples here. Primarily, we could think about a Kapha Pitta person with Vata secondarily, right? They're sort of heavy and fiery, but have Vata much subdued in comparison. Another type person might just be monodoshic, right? They start with Vata primary, and then the other two take a secondary role, okay? And then this third example is just another way to put into writing this concept. So Pitta 3, Vata 2, Kapha 1. So if you ever get to see your chart notes during an Ayurvedic visit, this is kind of a notation that I end up using. So if you feel excited about sharing what you've found, you can definitely send through the chat what you feel like your doshas are. So, and if you don't feel ready to share what your doshas are, you can always try and guess mine. So this third concept, I see a question here about the P3 V2 K1 notation. It just has to do with how do we orient the doshas as compared to each other. Because ultimately, when I think about Ayurveda, I think about a triangular dish. And in that dish is a marble in the center. And all of the angles of the triangle are the Pitta, the Vata, and the Kapha. And when you're born with a tilt to that dish. And if you're tilting towards Pitta, that's your P3, okay? With a secondary tilt towards Vata, V2, and the one that's hanging out in the air is K1 or Kapha. The goal of Ayurveda is to balance that dish, have the marble be in the center. So moving right along here. Additional concepts that inform the doshas. And you're going to be so well versed in these Sanskrit terms very soon. Prakriti is a really important concept. It's the doshic imbalance you are born with, okay? As compared to Vikruti is the doshic imbalance you currently have in this body in this time. So when I think about what a patient's doshas are, I often think about their Vikruti, okay? They come into my office and they say, I've got constipation and dry skin, right? We think about what's happening in the current doshic imbalance, which sounds very much like Vata, okay? Prakriti, however, is important because it can differ from the Vikriti. Okay, so your doshic imbalance that you are born with, that Prakriti, is informed by all sorts of things. The parental energies at time of conception, also the environment of the conception informs a baby's Prakriti. If it's hot midsummer and the parents are very excited about this experience, we can expect the Prakriti to be more Pitta, more fiery for the baby. In utero conditions also inform the Prakriti. If in utero the mom has a lot of Vata complaints, that informs the Prakriti of the baby. And then lastly, the birth story can also inform your Prakriti. If, the in utero conditions were just perfect, but the time of birth was really traumatic, for example, if you had an umbilical cord around your neck, if you were breached, if you were C-section, this birth story also informs your Prakriti. It's just important to keep that in the back of the mind, since most of the time we do talk about Vikriti, but thinking back all of those many years is really helpful sometimes for figuring out how do we move forward. Vikriti is the doshic imbalance you currently have. It's informed by all of your lifetime events. So what has personally happened to you from the time of birth to who you are now? If it's been, if you've lived in Santa Fe, New Mexico, most of your life, it's very possible you've got some Pitta imbalance. It's a very hot place to live, right? Very dry as well. Your environment, the surroundings that you grew up with, or your current surroundings, the people who are close to you, what you eat normally, your dietary patterns, your exercise practices, all of these things can have the doshas, can have one of the doshas out of balance, for example, and as a combination inform your Vikriti. So some objective tools for identifying your Vikriti, if you're still not totally sure, is we can do a pulse diagnosis. And this is something that an Ayurvedic practitioner could do, but you could practice this on yourself. If you've got a more leaping type pulse, we think of it as a manduka or a frog type pulse, and that's fiery, okay? Something else I can read in the pulse is whether there are two doshas interfering, right? Is Vata, is the air fanning the flames of Pitta, okay? This is a common pulse finding I see in my autoimmune patients, okay? So it's worth it. The pulse diagnosis is taken on the radial pulse, the radial artery, and something, like I said, that an Ayurvedic practitioner can do, but you can also play around with yours, see what you find. Tongue diagnosis, this is one of my favorite at-home ways to identify the Vikriti. Just go in front of the mirror, stick out your tongue, and look, okay? Is there a coating on it? What color is the coating? Is the central line really angular? Is there scalloping on the side of the tongue? Is there a red tip? All of these things help tell me that, okay, we're thinking about Vata in the back, in musculoskeletal pain, if the center line looks all angular. And then I think about low digestive fire when there's a thick coating, right? Indigestion ultimately causes that. So these are just tools for you to get interested in figuring out objective ways to find out the Vikriti. Other tools involve some new terms we will learn, which are Ojas, Agni, and Ama, okay? Ojas is your vitality, Agni is your digestive fire, and Ama is your toxic load. But before we get there, here's our intermission, our first intermission. So what I'm curious to explore here and kind of take a side path is to give you a little bit of concept. As we're sort of marinating these Sanskrit terms I just discussed, let's get a little bit of history. Let those terms sink in and look down a different path. So Ayurveda is, like I said, ancient medical science. How did it get here to America from India? I've got three thoughts here, or ultimately two thoughts. One is yoga, right? A lot of people think of yoga as being the sort of vessel for Ayurveda to grow into. And yoga is Ayurveda's sister science. So they do inform each other, but they are not necessary to practice either of these. And then secondly, if you think back to the 60s and 70s, there's a growing interest in traditional medicines, meditation, and herbalism. And people at that point were just starting to gather data that included Ayurveda, included traditional Chinese medicine. And so that sort of informed how Ayurveda got here. And some of our early Ayurvedic pioneers were from India, including Dr. Rosalie or Deepak Chopra, who's in California. And then our many, many, many yogis who have taught many classes of yoga and introduced these concepts. And now here's another question. How did Dr. Rosalie get here ultimately to Ayurveda? And this is just, I think I shared this slide because it's important for me, for you to know sort of my process here as well. I grew up with homeopathy, which is the constitutional medicine of Europe. And then I sort of grew interested in nutrition and food as medicine and healthy at 100, preventative health concepts. And that grew into essentially the catalyst for my interest in Ayurveda, which is an Ayurvedic text by a good old Deepak Chopra called Perfect Health. And it's a good one, to start with if you've got further questions after this talk about what is Ayurveda. Next, I sort of added on to that yoga and began a regular yoga practice. And then 2018 is when I finished my master's program in Ayurvedic sciences, along with my naturopathic medical degree. That Ayurvedic master's involved an internship in India where I was at an Ayurvedic hospital, and we were really witnessing these phenomenal ancient healing techniques for treating some of the common ailments of today. Some of my professors throughout this path, you might know their names: Vasant Lad, KP Khalsa, Shailender Sodhi, Duval Drew. They're sort of all in this Pacific Northwest region, some in the Southwest and Oregon. And then I sort of have gone from there in terms of teaching Ayurvedic classes and combining Ayurveda into my ND practice. Now, how did you get here? This is another important question to kind of think back and consider. Take a moment to acknowledge your personal health journey. Does it involve and did it involve Ayurveda, right? And where are there gaps? What are we looking to fill here in terms of optimizing our health, not just optimizing our health span and not just our lifespan? So there's our little intermission. Now we'll get back to some concepts. So we've already identified Prakriti, Vikruti, the doshas. We were remembering that goal is balance. And we're thinking about that triangular dish and how to pull from the opposite doshas to correct the imbalance that you see. The phenomenal thing with Ayurveda is the treatments are everywhere. From diet, nutrition, fasting and cleanses, to mindfulness techniques, to herbal medicine that's both local and from Indian herbs, to a movement practice like yoga, to somatic work like body work and massage, to breath work, also known as pranayam, to simple things like adjusting your surroundings, be it your environment or your relationships, having a new way to relate to the people that bring you out of balance. The next concept we'll discuss are those three Sanskrit terms, Ojas, Agni, and Ama. So Ojas is a really important concept. It is our vitality. And the way I like to think of it is through thinking of a honey metaphor. It takes so many bees, so many flowers, so much time to make that beautiful, delicious honey that is life-giving to the hive, right? Ultimately, humans also have this process as per Ayurveda, where we're taking in the outside world in our environment, but also digesting from what we eat and creating the subtle essence of our vitality, this honey, this ojas. We can measure ojas and our level of vitality by looking at our physical energy. Do we have extra to give at the end of the day? That would be someone with a good amount of ojas. Do we have mental energy and motivation and time to give to other people and other in other places? That would be a sign of a good amount of ojas. If you can think of that subtle essence as well, it hydrates all of our whole body, from our joints to our skin to our mucous membranes. So a well-hydrated, well-moving machine, well-oiled, is also one that has a good amount of vitality or ojas. And then lastly is one that has to do with sexual stamina. So if you can think of this subtle essence, this juicy combination of everything you take in, the most expressive way of seeing that is ultimately during sex, and how much stamina one has can be closely linked with their amount of ojas, their vitality, their availability to create new life ultimately. So to treat low ojas, there are many ways, and I've offered some of my favorites here. In terms of diet, we've got to think of juicy, nutritious foods, okay? This has to do with how do we build the inner juice. And one of my favorite ways to do this is to soak almonds overnight and then mix them in with some dates with an immersion blender. And that's a nice, juicy, nutritious way to build your ojas. Another big thing, one we're not really great at in this Western society, is mindfulness and meditation practice. Because if we're constantly anxious, stressed, distracted, we're very Vata. And we've got to sort of ground if we want to ground into the soil and build that juicy essence. Okay, so this is something that is so key to our daily life if we want to maintain our vitality. And then lastly, something that gets used really commonly in Ayurveda is body work, the somatic piece with oil massage typically. So oil is very building, it grounds the Vata dosha. And this oil massage can be whole body or just certain parts of the body, like the abdomen. It's what's known as an abhyanga. Any questions about the ojas concept before I move on to Agni? Excellent. So Agni is another huge one. It has to do with digestive fire, okay? In both naturopathic medicine and Ayurvedic medicine, if our digestion is not regulated, the rest of the body has a really hard time feeling balanced. So the way I like to think about Agni is think about the campfire metaphor. If you've got a blazing hot fire, it ends up overheating things and leaving a lot of coals, okay, which are essentially toxins at the end of the day. They're not able to be reassimilated into the soil, for example. If you've got a really wet campfire, it has a hard time getting started and burning those logs. This is a way to think about your own digestive fire, your own Agni. You can measure it by assessing your appetite. Are you someone who just coasts throughout the day, not hungry really? That would be a sign of a low Agni, okay? Are you someone who from one moment to the next is ravenous and hangry? That would be high Agni. That would be your appetite would be very high. And so ultimately we've got to find balance there. Your digestive capacity also tells me how good your internal fire is burning. Are you someone who gets full very quickly, who has indigestion very quickly, heartburn very quickly? That tells me there's a low digestive capacity, a low Agni. Same thing here in terms of energy levels. If your Agni is low, your energy is low. Number of meals per day can also inform how your Agni is doing in terms of how much is one able to eat in a day. Is it 3 meals and snacks, or is it just one and they're content? Okay. Elimination patterns is probably one of the biggest things when it comes to assessing for Agni, because like I said, if we're more constipated, that tells us there's a lot of dryness, a lot of Vata. If we have more of diarrhea or loose stools, that tells us that there's too much Pitta. So Vata type Agni or a Pitta type Agni, right? We've got to find the balance in between. To treat low Agni, there's a couple of ways, there's many ways, and again, here are some of my favorites. Diet involves decreasing portion sizes. That's a huge one, especially in this culture, and avoiding snacking, to give your stomach a break, give those digestive enzymes a break to then gear up again for the next big meal. Cleanses and fasting are something that have been used in many societies for many eras, and it's something we don't commonly see or do in our Western society. But seasonal cleanses are a big part of Ayurveda. Weekly cleanses even, or you can consider a daily intermittent fasting where we're just extending the fast from our sleep time, couple of extra hours on each end. And that's sort of what's known as intermittent fasting to help boost the Agni. And then an herbal blend that is excellent for this is what's known as CCFT. Coriander, cumin, and fennel in equal parts. Day, or those are gently heating digestive herbs. So our next Sanskrit term here is ama. All right, ama is toxic buildup. And this is the one where I think of our river metaphor. If we've got a slough that is full of trash, that is consistent with a body that's high in ama. If we've got a nice, clear, trickling river, which with a nice biodiversity around it, our ama is good. We don't have ama. We don't have this toxic buildup. Ama you can assess by looking at your tongue. Is there a coating? Okay, and oftentimes in Ayurveda, we recommend tongue scraping in the morning. Is there breath odor? Is there a body odor? Is there any foul smells sort of exuding? That tells us that there is ama in the body. Same thing with mucus production. Mucus is sort of a way for our bodies to process through toxins and eliminate them, okay? And lastly, elimination patterns tell us a lot about ama. Is there mucus in the stool? Are they not satisfactory, right? That could tell us a lot about your status of where your ama is. So treating high ama, so high toxic load. There's many ways, again, but here are some of my favorites. One of the big ones in Ayurveda is to avoid incompatible food combinations, okay? Which is kind of a specific concept. And if you Google incompatible foods, Ayurveda, you'll get all sorts of lists that tells you what they are. But ultimately, the concept here is it's hard for your stomach to digest something like milk when you also feed it something like lemon, all right? So one of the incompatible food combinations is dairy and citrus together. It takes essentially two types of enzymes to do the job, and they cancel each other out if you combine those, making it hard to digest what it is you just gave your body. Cleanses and fasting, again, are another big piece, and I like to just start with intermittent fasting with my patients, since it's sort of the easiest one. It builds Agni, remember, and if we've got a well-functioning digestive fire, our toxic load, our ama, does not build up. And then lastly, lifestyle. So this is where your exercise and movement practice that makes you sweat and helps eliminate the toxins ultimately that you've built up is going to be key. So here is another quick intermission where we step away from these Sanskrit terms and we think more philosophically about it. So here's a slide that I love, and it's about why I love Ayurvedic medicine, and it's something that ends up informing my naturopathic practice pretty heavily. I think about Ayurveda as a language or tool for talking about health that puts the healing in the patient's hands. So ultimately, it takes a couple of minutes to describe this language, but then as the patient, you have the opportunity to marinate it at home, think about it, try things out on your own time, and then cross-check with your practitioner if you've got questions ultimately. It's also a lifestyle medicine that combines mind, body, and spirit. So it's not just how is your physical health, right? Did all of your blood work come back normal? It also involves how is your mind? How is the body? How is your spirit feeling nourished? And then thirdly, it's a preventative medicine that addresses our health span instead of our lifespan. So it is a way of thinking about how do I stay optimally healthy instead of how do I live the longest. Fourthly, this is a concept that I kind of came together with a couple of years ago, but it's Ayurveda ends up being a three-dimensional medical practice, which is kind of confusing to think about. But when you think also back to our triangular dish with the marble metaphor, that's three-dimensional. We can play around in space with that concept as compared to a one or two-dimensional way of thinking about health, which can be put onto a graph, right? Where on this graph is your BMI, right? You've got weight and height and your sex, and all that gets graphed. It's very much 1 to 2 dimensional. Three-dimensionally is where Ayurvedic works. It sort of takes it off the page and puts it into space, something we can work with tangibly. And then lastly, it's not an exclusive medicine. We don't have to just do Ayurveda all day, every day. It's an excellent layer to just add on to your current health practices. So that was the intermission. Back to the concepts. Just to rephrase here, you know what Ojas are, you know what Agni is, you know your level of Ama, you know a couple treatments for the deficits. Remember that Ayurvedic treatments are numerous and everywhere. Anything can be used. So if you notice that, yep, I've got high Pitta, meaning I've got a lot of eczema right now, you've got to pull from the other doshas, the cooling doshas, the Vata and the Kapha, which, if you can imagine, has to do with cooling foods. So cucumber or aloe, these are all things that would help treat that hot Pitta pathology. So next up here, last section, is our simple Ayurvedic additions to daily life. So as a layer onto your current health regimen, this is something to add an Ayurvedic layer to it. So diet, ultimately, I would encourage all meals to be well spiced. And I mean this not in terms of hot and pungent spices, but in terms of digestive spices. Our gently heating spices like our ginger, our cumin, our curry mixture, our coriander. There's so much medicine in our spice cabinets, and a well-spiced meal means a high-functioning Agni, or digestive fire. Same thing here with adjusting our diet based on the weather and the season. If it's midsummer, I would encourage for you to have more cooling foods: watermelon, cucumber, parsley, carrots, right? If it's midwinter, and if you're in the Pacific Northwest and it's very wet, very windy, very cold, it's not the time of year to be having ice cream, right? It's not the time of year to be adding yogurt to your oatmeal. It's the time of year where we need something more heating to adjust based on the current weather patterns in our environment. Lastly, in terms of diet, is to eat only when your Agni is high. Okay, so you can assess where your Agni is on a daily basis. And if it's low, give your body a break. Give yourself a couple hours of a fast, ultimately, because if your Agni is not high, we're building up Ama, which is that toxic load. In terms of sleep, this is a big one. So in bed before 10 p.m., and that has to do with the certain times of day where Pitta is the highest, okay? Pitta is fire, Pitta keeps you up. From 10 to 2, right? And right in the middle is midnight or high noon. Those are our Pitta hours, where a lot of people get a second wind creatively to do, to do their tasks from the day that they haven't gotten done yet. If you're in bed before that Pitta hour in the Kapha time of day, you are able to fall asleep more deeply, sleep through that Pitta hour, and make it to the other side, ultimately. Otherwise, if you've experienced this before, if you start going to bed at 10:30 or 11, maybe you're up till 2, ultimately. You've got this second fiery wind. So that's a big one we can sort of add on and layer in to our current health practices. Lifestyle involves daily breath work, or pranayam. And the one I like to start with is alternate nostril breathing. And why breath work? It has to do with the fact that we think so often about what to eat, how much water to drink, how much sleep to get, how many steps per day, but we forget about how to breathe. And you can't go 3 minutes without a breath, ultimately. It's a lost art. And in this Western society, we breathe often into our shoulders more anxiously and less into our bellies. We breathe more often, which will affect our health span and lifespan ultimately. So daily breath work, especially this alternate nostril breath, is a way to retrain the respiratory tree to ultimately train it to breathe more regularly without these sort of breaks or moments like sleep apnea at night that sort of stop our breathing, hold our breath, contribute to anxiety. So if you go to YouTube, type in alternate nostril breath, there are a billion yogis who have ways of how to, who walk you through how to do this. But that's just an excellent one to just add in right before bed. You can be in bed practicing this breath. Lastly, here is herbal medicine. Okay, one of the famous herbs in Ayurveda is tulsi, or holy basil, and it's holy in Ayurvedic medicine in that it has a lot of wonderful actions. It builds our Agni, it builds our Ojas, and it diminishes Ama. Sort of as a whole, this is quite an energetic and helpful herb that is far-reaching to all individuals and all doshas. So what's next? I talked about a lot of stuff. And ultimately, the way I like to end my Ayurvedic visits is just to remind the patient that every choice is an Ayurvedic choice. You can make an Ayurvedic choice any time of the day, from what you're going to eat for lunch to how you're going to move your body and how you exercise, or what yoga pose you end up in. And this is what's so empowering about Ayurveda, is that the choice ends up being in the patient's hands. And, you know, if questions come up, you just come back to the texts or to the concepts, or you have your Ayurvedic practitioner check your pulse. There's a couple of resources here that are great places to start in terms of concepts, in terms of diet. And one of my favorites is this last one here by Divya Alter, and it's What to Eat for How You Feel, ultimately. And it's taking in the Ayurvedic concepts to the next level in terms of meal planning. If you're interested to know more, I do Ayurvedic consults here in office or telemed, something you can schedule on our website, prospernaturalhealth.com. And now we've got a few minutes for one of my favorite times of these Doc Talks, which is the Q&A, where if you've got questions about these concepts, you want me to clarify things, please speak up, type in the chat. I'm here to help clear things up. So we've got one brave soul. Excellent. So the question is, how do you work Ayurveda within families? Excellent question. It honestly, so the thing with families is that the people who come together and make a family are usually from the opposite doshas. Okay, so you get someone who is very Kapha, who connects with someone who's very Vata, and they have offspring. That's a connection of both. And it's something that what ends up being clear for families is that we just need a default general sort of Ayurvedic doshic balancing diet, lifestyle, etc. And we add on to that things that boost the specific person. So for example, a nice doshically balanced meal would be something like, we'll say, pumpkin soup. All right. And our very Pitta person we would omit the hot sauce for. Our very Kapha person, we would omit the cream for. Our very Vata person, we would make sure it was nice and warm in terms of temperature. So you can make a one-pot meal, and then everyone at the table can add their own spices or their own sort of balancing aspects Ayurvedically. But it does start from just a baseline of trying to be as even as we can from the start and building from there. Excellent question. Did that help clear it up? Yes, so the follow-up question is, so we changed diets over our years within families? Yes, ultimately. It's a constantly evolving concept. So this is something that's very different than the Western medical concept, where once we've reached health, we've reached health. And in Ayurveda, it has to do with we're constantly in a flow. The environment is telling us, is informing ultimately how our Agni is, how our Ama builds up, what our Ojas are, right? So things are constantly in flux. Nothing is certain ultimately. So that even involves how we change our diet on the daily or seasonally, etc. We've got a raised hand. Go ahead and ask your question, David. I can't quite hear you. Are you able to type in the chat? Sorry, David. So if you see on the bottom of your screen, there is a little microphone that says mute or unmute. If you click on that symbol, we can hear what your question is. So sorry for the other IT jumble here. If you do want to send me an email, if you've got further questions after this talk, my email I'll put in the chat here is Dr. Rosalie at prospernaturalhealth.com. So that's DR and Rosalie, my name. So any Ayurvedic questions or anything in general, I'm happy to respond to. If you've got questions about setting up a consult, our front desk can help you navigate. Lastly, here's our DocTalk schedule for this upcoming year. That's our naturopathic DocTalk schedule. You got a bonus Ayurveda one this month. You get a bonus traditional Chinese medicine one next month with Dr. Mary, our naturopathic acupuncturist. And I just want to thank you so much for being here today, taking your lunch hour with me, and hope to hear from you all soon, either through the email or any other method. Thank you so much.